Good day, I'm Ilo Ogwanimu, welcoming you to Ask the Doctor. Today on Ask the Doctor, we'll be looking at diabetes. It is estimated worldwide that more than 140 million people have this disorder, and according to the World Health Organization, that number could be doubled by 2025. To know more about this, or before I introduce my guest to you, let's go on a short break.
It is not good for man to live alone in this journey of life. Everyone needs a helpmate. African Broadcasting Network, your trusted partner, your family station.
Welcome back. If you just joined us, the program is Ask the Doctor, and today we'll be looking at diabetes. My guest today is Dr. Eko Tugbo Idewu Michael. He is a medical officer with Delta State's Oil Producing Area Development Commission, DESOPADEC. Dr. Michael, you're welcome to the program.
Thank you so much.
And it's nice having you today. So you've heard from the introduction. So what is diabetes?
Thank you so much. Diabetics is a clinical syndrome that is characterized by hyperglycemia due to absolute or relative deficiencies of insulin. So basically what this old jargon means is that carbohydrate is involved here. When you eat any form of carbohydrate food, it gets to the stomach. And very close to the stomach, there is an organ that is called the pancreas. This pancreas has these cells that releases hormones. One of the hormones that is of major concern to us here is the one they call insulin. The job of insulin, or the physiological function of insulin, is to reduce the blood sugar. It is important we know the blood sugar different from the tissue sugar, different from the sugar in the muscles. In the liver, there is the blood sugar. Insulin has a duty to reduce that blood sugar by transmembrane transportation. Now there is another hormone released by same pancreas called glucagon. Glucagon has a physiological function of bringing back that sugar that was taken from the blood, the excess sugar taken from the blood back to the blood for you to function normally. So when this hormone in question is either lacking completely or is there but is difficult to come out, which is the relative and absolute deficiency of insulin, then there will be a lot of sugar in the blood, which is the hyperglycemia.
Okay. So what are the types?
Now, the types of diabetics as classified by WHO, World Health Organization. WHO grouped diabetes under 3 groups, for which you have diabetes mellitus, you have impaired glucose tolerance, and you have gestational diabetes mellitus. Under diabetes mellitus, you have the insulin-dependent diabetes mellitus. You have the non-insulin-dependent diabetes mellitus. You have the malnutrition-related diabetes mellitus, and you have other types of diabetics, in which case the pancreas is affected genetically, whether by inflammation, drug-induced, anything that disturbs the normal production of these hormones from the pancreas.
Okay. These three groups that you've mentioned, do they have a specific cause, or each of the groups have their different causes?
Yes, each of the groups have their different causes. First, if we look at the insulin dependent, meaning that insulin must be present. What it therefore means is that the pancreas cannot produce insulin. It does not have insulin. Therefore, you must have a way of bringing insulin from outside. It's called exogenous. It depends on that exogenous insulin to be stable, to be normal. The non-insulin dependent diabetes mellitus means that to an extent there is some element of insulin in the pancreas, but whether by way of difficulty is difficult to come out. So there must be a way of bringing it out from the sac. It is relatively there. It must come out. The other one, which is the impaired glucose tolerance, is just between the normal range of acceptable normal range and tilting towards diabetes. You cannot say it is diabetes, yet at the same time you cannot say it is normal. It's just intermediate between. Then the gestational diabetics mellitus. This one is common in pregnancy, especially when it is detected for the first time in pregnancy. It is gestational diabetes mellitus.
So will you say that the cause was due to the pregnancy, or what will you say?
Yes, the cause is due to pregnancy.
Due to pregnancy.
Due to
So
pregnancy. Pregnancy induced diabetics mellitus.
Is there any risk factors?
Risk factors for diabetes? Yes. Basically, the etiology of diabetes is uncertain. But environmental factors interact with genetic susceptibility to determine which of those with a genetic predisposition develop the clinical syndrome and the timing of its onset. What it means is that there is a genetic part of it and there is environmental part of it. Now, the risk factor is associated with the environmental part of it. And talking about the risk factor, we want to look at the lifestyle modification of the individual. We want to look at the diet of the individual. You understand? The age, because this is a risk factor. The occupation of this individual. You understand? Now, for those that smokes, smoking is a risk factor. For those that have high blood pressure, these are risk factor. Elevated cholesterol. You understand?
What about alcohol?
Alcohol is there. Is a risk factor, major risk factor for diabetics.
Okay. So is diabetics, is it hereditary?
Like what I have said, it is both hereditary and environmental. The causes of diabetics, the etiology is uncertain, but these factors interact to give rise to diabetes mellitus.
Doctor, at what age a person is prone to diabetics?
Basically, diabetes is a disease that affects anyone at any age, from conception to adult age. Now, the types of diabetics matters again. It is said that the insulin-dependent diabetes mellitus is common among the age group of less than 30 years, with a peak period of 10 to 14 years. While the non-insulin dependent diabetes mellitus comes within the middle age and in adult age. Now, because of our lifestyle modification, this non-insulin dependent is now found common in the younger age group. So diabetes cuts across all age group.
Well, viewers, if you just joined us, the program is Ask the Doctor, and today we've been looking at diabetes. Before we continue more on this topic, we'll go on a short break. More of this when we return.
It is not good for man to live alone in this journey of life. Everyone needs a helpmate. African Broadcasting Network, your trusted partner, your family station.
Welcome back. If you just joined us, the program is Ask the Doctor, and we've been looking at diabetes. If you have questions, our email address and numbers are showing on your screen. Doctor, there is a common saying that diabetes is caused by eating sugar. So how true is that?
It is true and no. Now, we started by saying that the hormones insulin is released from the pancreas, and its physiological function is to decrease the blood sugar. It does this by storing the excess sugar in the blood in the muscles, in the liver, and the adipose tissues. Now, if there are many sugars in the blood, so to speak, the excess sugar, because the body needs sugar to function. You need sugar to talk to me. Peradventure, when you are fasting, you have not eaten for 2-3 days, you need the body sugar to live. Now, this excess sugar is converted and stored, waiting for when there is need for it. So the blood sugar that is excess, if it remains in the blood in that form, there is another system of the body that will come to remove the excess sugar through the excretory system. So eating sugar per se does not cause diabetes, because the excess sugar is meant to be converted. Failure of these hormones and the necessary cells and tissues and organs that should regulate the sugar in the blood, where it fails, will now make excess sugar be in the blood. So it is not the eating of sugar per se that causes diabetes. Then true, in the sense that excess sugar in the blood again becomes a risk factor for diabetes.
Wow. Does it have a cure?
Cure. Basically, all conditions in life don't have cure, but they are managed. Diabetes is a non-communicable, it's a chronic non-communicable disease that, when properly managed, will make the individual live a normal life and to the very ripe age that God has destined for that person.
Okay, they can live a normal life.
Yeah.
Okay. So what's your opinion about those who believe that it can be managed or it can be cured with herbs?
Those who believe that diabetes can be cured, managed with herb, have their opinion. For me, I wouldn't have much to say about that, because basically that is beyond my scope. But the interesting part of it is, over time, we have seen that those who come to the clinics with complications of diabetes have this history of having gone to this traditional home have this history of having believed in a faith-based organization, and yet they still come with this complication. If they had reported earlier, then it would have been stabilized, managed for them. So I do not believe, I cannot say whether herbs cures diabetes, but medically speaking, diabetes can be managed.
Okay. Before we talk about the management, so what are the symptoms?
The symptoms of diabetes depends on the presentation. Now, the classical symptoms goes thus. Here is a patient that urinates often. He is always urinating. We call it polyuria. Because he's always urinating, let's say, so that everybody can understand me, this person is always thirsty. He wants to drink water, so he drinks water frequently. Polydipsia. And while the urine is coming out, the cells too of the body, they are coming out. You know, if you did biology, you know the principle of osmosis, that it moves from a region of a low concentration to one of high concentration through a semi-permeable membrane. So in the system, in the urinary system, there is sugar, and once there is sugar, sugar will now attract water from the body, and it comes into the urinary system, and it is excreted. Where you excrete, remember that all living things, they need sugar to live life. So including ants, insects that you see where the person has just finished urinating, they too want the sugar in the urine. So you will see, if you observe the urine closely after some time, you see ants gathering the urine. Now, these are symptoms of diabetics, though not limited to diabetics. You understand? Now, the sugar that is coming out will equally be reducing the cells, the tissues of the body. So, as long as the person keeps excreting sugar, the person is thirsty, the person is hungry. Hyperphagia, you keep eating food. But the irony in it is that rather than gain weight, the person keeps losing weight. So these are the symptoms, the classical symptoms of diabetes mellitus. But again, because we do not go for routine checkup, some cases are accidentally discovered, diagnosed. Or you go to clinic for management of conditions not related to diabetes, and in the course of investigations, it is picked up. Then 3, there are those who comes with the complications of diabetes. So it depends on the state at which you present for investigations.
Apart from urinating, is there any other symptoms that someone need to watch out for? Because you made mention of urine.
We made mention of, as you urinate,
yes,
you drink a lot of water. As you drink a lot of water, you are hungry, you eat a lot of food.
Okay, then losing weight.
You are losing weight.
Oh.
These are the classical symptoms of diabetes.
Okay, so what kind of these symptoms that you've talked about? So what kind of medical centers that can handle such situation?
Now, handling or management of diabetes is all encompassing. It cuts across from the government angle, from the family angle, from the patient angle. Basically, there are levels of preventions.
No, we'll get that. Is it all medical? Is it in all medical centers that can handle such?
Yes, it's in all health facilities that diabetics can be managed. But the best place to manage diabetics is at the primary healthcare centers. A lot of times we make the mistake of thinking that in the teaching hospital will manage the complications of diabetes. So in case you are diabetic out there, make good use of the primary healthcare center available within your vicinity. There you will be close to the health personnel on ground. You know your health challenges. You know that you follow instruction. In fact, you should know, you should have a working diagnosis, a working knowledge about the condition that you are faced with. And by that, you will live a normal life.
Okay. Before we come to the normal life you're talking about, so how can it be diagnosed?
Diagnosis is both by urine and by blood. But again, it is for the laboratory personnel.
Ella, you said a diabetic patient can live a healthy life. So are there lifestyle they're not supposed to live, or what are the diets they're supposed to be placed under?
We talked of a lifestyle modification. Once you know you are diabetics, as it concerns diet, the whole essence is the blood needs some amount of sugar at any point in time. You know, here in this side of the world, we are very good at eating heavy carbohydrates. It's like our staple food. You eat rice, you eat cassava, you eat this, you eat that, you drink beer, you drink minerals. All these are carbohydrate food. So once you know that you are diabetic, you now eat little at a time. In fact, when you see your doctor will advise you on dieting. Basically, here you can live a normal diet on beans, on plantain, on ripe plantain, on amala, vegetables. Then little, let me say this here, that no doctor will ask you not to eat any form of food. But abuse has always been recorded. And because we have a tendency to abuse what we eat, you are now restricted to this diet I have mentioned. Otherwise, if you follow your doctor's instruction, if you follow your drug regimen, and you follow your dieting as instructed, then you will not have the complications of diabetes.
You talked about drug.
Yeah.
So is the drug, is it what the common man can afford in our society?
Sure. The drugs are everywhere, but again, you will need to see your doctor. The drug for A may not be the drug for B. Because in managing diabetes, diet alone can resolve the case. Where diet cannot do it, diet and oral hypoglycemic drugs can do it. If not, diet and insulin can do it. So the line of management is along this line.
So will you say it's deadly?
Diabetes.
Yeah.
Diabetes is like any other disease. And besides, it's a non-communicable disease. It's not a deadly disease. It depends on how you manage it.
Okay, management is seeing a doctor. That's one of the best way to manage it.
Management is knowing what you have, regulating your drugs, regulating your diet.
Okay, so let's talk about prevention. How can it be prevented?
Prevention, basically, I want to classify it under primary, secondary, and tertiary prevention. At the level of primary prevention, we want to look at population strategy and high-risk strategy. Under the population strategy, the scope for primary prevention of the insulin-dependent diabetes mellitus is limited because of the knowledge, the current knowledge, and is probably not appropriate. Now, but however, the development of prevention program for the non-insulin dependent diabetes mellitus is based on elimination of environmental risk factors. Because we just talked of these risk factors: the diet, the lifestyle, the other ones were mentioned. Now, if you regulate all those ones, it will prevent the diabetics mellitus. Then when you talk of the secondary prevention, at this stage, remember in the first one, the diabetics is not a blown one yet, so you can regulate it. Somebody goes for laboratory investigation with a high sugar level. You start cutting down on sugar intake. You used to drink 5 bottles of beer. You say, no, I'm not taking any one again. Certainly, you will reduce the sugar level. Now for the secondary level, now the diabetes is known. Then it demands adequate treatment. Adequate treatment. So what I said before, this is where it comes in, where you can manage it by dieting alone, or you can manage with the oral hypoglycemic drugs, or you can manage with insulin. But remember that all those lifestyle modifications, all those lifestyle behavior that prones you to diabetics needs to be checked. So there is need to check your weight, there is need to check the food you eat, there is need to check your blood pressure, because these are the things that gives rise to the condition that contributes to developing the condition. For instance, if you are a smoker, you need to quit smoking. If you have high blood pressure, it needs to be managed. For those with conditions that can give rise to atherosclerosis, these are conditions that you need to check. Then at the tertiary level, basically there is now need for what you call diabetic centers. Diabetic centers, because yes, it is. Now the problem with us is we don't make use of available health facilities. So we have this mentality of seeking self-care, in the sense that you do self-medication, you patronize one chemist, you see this, and in fact we believe so much in prayers. Everything is handled by prayers. Everything, even diabetic now, is spiritual. So everything is handled by prayer. But it's not true. It's not true. So in diabetic centers, you are trained, you are taught, you are told the conditions you have, you are told how to manage these conditions. In fact, ideally, you should have a card that have your details, your name, your health conditions. You know how to take your injections, you know how to take your drugs, you know how to go about the management. Then, two, I want to use this medium to appeal to government at all levels to continue government political will. If the government is not interested in management, there's nothing you can do. But where there's government political will, like here in Delta State, we know too well that the present government of Delta State have established health centers. In fact, there are, through the Ministry of Health in Delta State, there are a special scheme for certain age group. Above 70 years, they have free treatment. Below 5 years, under 5, and they have treatment, free maternal. These are places where these conditions can be easily picked up. Now, I equally want to appeal to the users, the patient, the sick people, the people that are not even sick, that needs to know their diabetic status, to keep making use of these health facilities. These facilities are not in their domain for fancy. It is there to be used. Then to the health professionals, of course, they have been doing wonderfully well. I want to appeal for their continued patriotism to this job. Then to the press, like you, It is when you say it out, it is when you hear it, that people out there in the rural community can know about what is happening. I want to appeal to you to continue on what you are doing.
Okay. Thank you. So you talked about, you said checkup. You said in this part of the world that people do not go for checkup. So how often do we need to go for checkup?
When I started, I said that most times before some people come to the hospital, they come with the complications of diabetes. Now, routine medical investigation, routine medical checkup is very important. When you go for routine medical, for instance, if I may ask you, in the last 6 months, have you checked your diabetes status? Have you checked your sugar level? You know, these are the things that we need to know. If you are in school, there's routine medical checkup before you.
Should be done?
Yes.
Every 6 months.
Not necessarily 6 months.
Year.
It's at intervals that is convenient for you. If you say it's every 6 months, every 3 months, every month, if you have a patient, a patient that is diabetic, 6 months may be quite a long time for such a person. Okay. If you ask somebody that is not yet diabetic, you need to go for routine medical checkup. But basically, your doctor will be able to tell you, give you a time frame for which you check your sugar level.
Okay, if you notice my intro, when I was giving my intro, as in 140 million people have been diagnosed, and according to the World Health Organization, that figure will be double or could be double by 2025. So what can the government do to reduce diabetics in Nigeria?
All we have been saying, like the appeal I made to government, is something that government can do to reduce. But the onus does not lie on government alone. Like I said, it's all encompassing. You are involved, I am involved, the government, the clergymen, they are part of the system, they are part of the community. So in the different churches, there should be an awareness. There should even be a diabetic control group in the church that will give health education, diabetic talks at intervals, so that people are aware of what the conditions are and how to manage the conditions.
Okay. One more question before I let you go, doctor. So people out there watching, what do you want to tell them?
Viewers out there, this is a wonderful opportunity to talk with you. I want to encourage you to always go for routine medical check. If you are diabetic, I want to advise you to always listen to your doctor, adhere to your drug regimen, control your diet, check your weight, and reduce all those lifestyle risk factor that can tilt you into this disease condition, and you'll be okay.
Well, that's how we wrap it up on our favorite program, Ask the Doctor. If you have questions, our email address and phone numbers are showing on your screen. I'm Ilo Ogwonimu saying health is wealth. So take very good care of yourself and live a healthy life. Till I come your way, God bless you.